Welcome to Direct Secure Messaging Basics. This information is being presented by Big Sky Care Connect. This project is funded in whole or partly under a contract with the Montana Department of Public Health and Human Services. The statements herein do not necessarily reflect the opinion of the department. All information and materials contained in this presentation are copyrighted by Big Sky Care Connect. All rights reserved. All materials are provided for non-commercial, personal use only, and may not be copied, duplicated, altered, or transferred to any medium whatsoever. I, Kelly McDermott, will host this presentation. I am a trainer with a background in education and am currently the training lead for the Big Sky Care Connect Health Information Exchange. This presentation was designed with input from Big Sky Care Connect's Direct Secure Messaging Global Administrator, Amy Lotz. In this session, we are going to discuss some basic definitions related to Direct Secure Messaging, how it works, and the benefits of using DSM. First, let's define some terms related to Direct Secure Messaging, or DSM. DSM is a technical standard for exchanging health information between healthcare entities, such as primary care physicians, specialists, hospitals, and clinical labs, in a trusted and secure network. It is easy to use and functions like regular email, with additional security measures to ensure that messages are only accessible to the intended recipient, per the protection regulations of the Health Insurance Portability and Accountability Act. And DSM helps Medicaid-eligible providers meet Measure 1 when seeking attestation to the Meaningful Use Stage 3 Health Information Exchange objective. A Health Information Service Provider, or HISP, is an accredited network service operator that operates the servers that support DSM Exchange and house the certificates on behalf of their clients and their clients' users. HISPs are regulated, monitored, and accredited by directtrust.org, a healthcare industry alliance created by and for participants in the DSM network. Essentially, the HISP is like the postal service for your direct secure messages. Direct Trust is a nonprofit that oversees the use of the direct messaging protocol to promote secure, interoperable health information exchange. It is the standard for DSM. The mission of Direct Trust is to support health information exchange in the interest of the public good, as a nonprofit, competitively neutral, membership learning organization for voluntary self-governance of health information exchange. Direct Trust is American National Standards Institute, ANSI, accredited. Big Sky Care Connect, or BSCC, is a nonprofit corporation established in 2018 formed by healthcare stakeholders to operate a health information exchange, or HIE, in Montana that enables the secure sharing of vital healthcare information to improve the speed, quality, safety, coordination, and cost of patient care. BSCC serves as a statewide network and repository for patient health information, including comprehensive clinical and claims data, and offers HIE-related services to the Montana healthcare community to connect providers, payers, and patients. Secure Exchange Solutions, a leading HISP, connects healthcare stakeholders through secure messaging. Secure Exchange Solutions offers all healthcare stakeholders seamless and secure communications on the Health Information Service Provider platform, known industry-wide for its accessibility and high performance. Secure Exchange Solutions is fully accredited and complete with end-to-end message encryption and robust directory services. so end users and administrators enjoy the maximum level of data security, connectivity, and reach possible. BSCC offers secure exchange solutions direct to connect healthcare stakeholders within the Montana HIE. BSCC DSM delivers the greatest connectivity and reach throughout the Montana healthcare community and provides maximum accessibility to secure messaging through external data representation and web browsers. Our DSM is not only secure, but also convenient. So direct secure messaging is just email, right? Not quite. The DSM standard makes direct electronic communication by requiring not just the technical processes, such as message encryption, but also identity proofing of users to ensure protected health information is not disclosed to an unintended recipient. There is a trusted agent at each facility that is required to undergo identity proofing through secure exchange solutions and is also responsible for identity proofing of their organization's users through an agreed-upon process. DSM works much like the Postal Service, with a lot of the security measures taking place behind the scenes. Think of your message as a letter you wish to send. Direct secure messaging is the envelope you send it in. It contains all the information needed to get your letter to the appropriate recipient. The health information service provider is the Postal Service, ensuring your letter is sorted and secure. The message is transferred to the sender's service provider, Secure Exchange Solutions, to ensure it is encrypted, and then from that health information service provider to the recipient's service provider. The health information service providers explicitly trust each other and exchange the message. The recipient opens the direct secure email portal, securely logs in, and accesses the message in their inbox, much like walking to your mailbox to get your mail. Now that you know how it works, BSCC's DSM offers many benefits to healthcare workers and patients. It is very user-friendly and similar to popular web emails such as Google and Yahoo. Your organization is not required to have an electronic health record system to access DSM. This can be done easily through the Montana HIE. DSM replaces outdated and timely efforts of faxing to other providers. Organizations and BSCC will enter into a HIPAA-compliant business associate agreement to protect both entities and the patient from liability and unintended disclosure. BSCC's DSM provides various reports for your organization to gather data from and to save for audit purposes. And information, such as summary of care reports from other physicians, is shared quickly and conveniently with the patient's primary care doctor, so patient record information is always up to date. This is extremely important in emergency situations when access to up-to-date patient information saves vital treatment time. One of the best benefits of DSM is the ease of sending important healthcare information securely to other healthcare providers that need it. Send continuity of care documents, referral documents, transition of care documents, hospital discharges, summary of care documents, test results, patient encounter notes, medications and allergies, and anything you might have considered faxing. With the latest developments in the global spread of the coronavirus disease and the related World Health Organization guidelines, the speed and availability of DSM is vitally important to ensure information is conveyed to the correct recipients quickly. Direct Trust has announced the number of organizations utilizing DSM increased to more than 5.4 million during the first quarter of 2020. This pandemic has stimulated communication with new healthcare providers. Organizations are realizing they need to communicate structured and unstructured data quickly to other professionals And the best way, the secure way, the HIPAA compliant way, is to do this through direct secure messaging. If you have any questions or you are ready to sign up for BSCC and the DSM service, contact Big Sky Care Connect at 406-422-1078 or send an email to information@mtbscc.org. Thank you.